So today is 14 weeks, so 3.5 months since Chickpea tore her CCL, basically the dog equivalent of the ACL, the ligament in the knee. And today is our 8-week checkup since the surgery. So 8 weeks since surgery. And today Chickpea has to go in for radiology, and they're going to take a look at that knee. And they're basically going to tell me how it's coming along, where the healing is at, and that's going to dictate the next steps, like how much more physio I can do. And there wasn't too much to update over the last, let's say, 4 to 5 weeks. It's just been increasing the walks every day. Chickpea is trained to walk backwards. Chickpea, reverse. Very good. Keep it going. Keep it going, baby girl. Yes, good girl, heel. So real basic stuff. Just increasing her walks, and currently I'm up to about a 20-minute walk in the morning. Then I take her out for about a 10-minute walk where we do a bunch of this, because in the morning I walk her with all of the dogs, so Penny and Ollie, and can't really do the rehab work when you've got 3 dogs with you. Come on, P. She's also a little slower, so I've adjusted my speed when I walk with her. And then I take her out midday for about a 10-minute, maybe 15-minute walk, depending on how much time I have and how she's been doing, and we do all our rehab stuff. And then I take her out for another 10, maybe 15-minute walk just before dinner, and we do more rehab stuff. But that's basically been the way it's looked. She has been on a leash the entire time. She has not taken one step off leash in the last 12 weeks. And I haven't had to use the harness, but as I mentioned in the previous video, I've just been keeping the harness on because, I mean, I'm a block away from home. What happens if something goes on and her knee buckles and I've got to assist her home? And I'm hoping today they say that that bone is fully healed and looking great, and I can, at the very least, stop putting the harness on. But couldn't be more happy with Chickpea's progress, but we'll see what the vet says today. All right, I got to get home and get to the vet. Well, that was easy and painless, at least for me. All the dogs had heartworm tests today, so they all had to get a little jab to get some blood draw. So maybe not as nice for the dogs, and certainly not as nice for my wallet. But all of you that are dog owners out there know that health care for your dog can get a little pricey, especially when something like this has happened and you've needed surgery. Everything looks good. They did check both knees when they did the radiology, and they said that her left knee looks great. The right knee, which is her right hind leg, is where we had the surgery done. And they said there's a little bit of an imbalance in the muscle. So there's been a little bit of atrophy in the muscle, which is to be expected because she was on bed rest for several weeks, and we're just building up her activity now. They have to send the x-rays off to the surgeon that did the surgery, and she's going to take a look, and then they're going to get back to me and basically let me know how much it's healed, how far Chickpea is along, and how much I can expand all of her rehabilitation and her exercise. The one note I would like to leave everybody with is this. If you're going to do something like this, the TPLO surgery, you're going to have a major surgery for your dog, I want you to think of it as an investment in your furry little companion. And my goal, and this is the phrase I'm going to leave you with, so keep this in mind, protect your investment. And what do I mean by that? This was a financial investment in Chickpea, right? It cost us around $6,000 for the surgery, and it would be maybe $1,500 more if we did the physiotherapy. But because I did physiotherapy last year when she had the FCE, the spinal stroke, I'm pretty well versed in the physiotherapy, so I chose to do it on my own this time and save myself the money. But this can get very expensive. And if I don't follow the vet and the surgeon's instructions, things can go wrong. And then I've essentially wasted that money. I've wasted my dog's chance at a healthy recovery. So it's really important. I want you to think when you're doing something like this is an investment in your dog's health. It's a financial investment, and it's going to be a time investment because you're going to have to put time into rehabilitating your dog and bringing them back up to, full strength again. So I'll say it again, protect your investment. And what I mean by that is listen to your vet, listen to the surgeon. Chickpea has not been off leash for 14 weeks, not even for one moment, not even moving around in the house. If I take her up the stairs, or when I take her out to go to the bathroom, when we're walking around in the yard, she has been on a leash. That's what the instructions were, to make sure that I can control her movements so she doesn't do something stupid and jeopardize this surgery. It's a lot of money, it's a lot of time, and I love my dog, and I want to, say it with me, protect the investment, okay? So if you get something like this done, I highly recommend listen to what the vet tells you and follow it to a T, and you will have a good recovery just like I did with Chickpea. All right, I got to get these dogs home, and then I will do one more quick little update in this video once I hear back from the vet, once they hear back from the surgeon. We'll see you then. Who's a happy girl? Well, I hold in my hands the printout from the vet. Yesterday was the appointment, so they've gotten back to me end of day today. And I'll just give you the brief synopsis. I'm not going to read all of this, but essentially, Chickpea is doing very well. The radiographs show excellent healing. The bone is almost fully healed. Implants are stable. There's a bit of patellar tendonitis, etc., but that's all to be expected during the healing phase. And keep in mind, we're 14 weeks out from the injury and 8 weeks out from the initial surgery. Over the next 4 weeks, she still has to be on leash. So in caps, they've said controlled, on leash. We can now add a little bit longer walks. We can increase by 5 minutes per week. So multiple walks a day, but I can increase the length of those walks by 5 minutes a day. We can do some light trotting on the leash here and there, walking through sand, tall grass, up down hills, and sideways across the hill. She can continue to go up flights of stairs, but on leash. We're to continue the real basic physio that we've been doing, the sit to stands, doing little figure eights on the walk, etc., all of that stuff. The goal right now during this stage of healing is to strengthen the muscles in the leg while the bone finishes healing. So that's where we're at. After that, the following 4 weeks. So for the next 4 weeks, everything's controlled. After that, so now we're looking at just past 12 weeks, 3 months since surgery. After that, we can slowly reintroduce off-leash activity at the end of leash walks. They want it at the end of the leash walk so that all the muscles are all warmed up and she doesn't do something, all of a sudden, a drastic maneuver where the muscles are not warmed up. But this is 5 minutes. So 12 weeks, 3 months after surgery, and we can now allow her 5 minutes of off-leash time after a walk. The vet also chatted with me yesterday about long-term arthritis management, because this is going to be a problem. Of course, when you get a major surgery like this on your knee and there's implants, there's probably going to be some type of arthritis or issue in the future. So they talked to me about omega-3 fatty acids, glucosamine, some different products that we can look at. And in addition, they've recommended a joint supplement called Cartrophen, and that's an injectable. So Chris is going to handle that because Chris, my wife, is a type 1 diabetic, so she's a master with a needle, and I don't think I could do it. I mean, I would do it if I had to, but it's nice that my partner will take care of that, right, P? So we have to give her this, and it's just an injection once a month, so it's not a big deal, but this will also help to stave off arthritis and keep the joint healthy. And that's about it. So that's where we're at right now. So when you really think about this, let's say your dog injures their CCL, right, their cruciate ligament. It's called the cranial cruciate ligament in a dog, but similar to the ACL. You're probably looking at about 4 weeks until you can get into surgery, okay? And then we're talking a total of 16 weeks after surgery is the basic recovery time. And then essentially they're saying after that point, so once Chickpea is a total of 4 months post-op, so 4 months after the operation, there should be no further restrictions needed. So you're looking at almost a half a year. If your dog gets injured and they tear their CCL, probably a month until you can get into surgery. You'll be doing some management. So if you remember from the first video, I was able to walk her under control very carefully because the knee had no stability. But you're looking at almost 6 months, just over 5 months, probable total time for this. And our cost right now is probably just over $6,000, but that's because we had a lot of the stuff we needed for physiotherapy, the harness and all of this different stuff we had from when Chickpea had the FCE, the spinal stroke last year. So you're probably looking at around $6,500. Also keep in mind, we spent $1,500 last year on physiotherapy, and the only reason I'm not paying that now is because I went through physiotherapy and I know how to do it now. So if your dog's never had an injury like this, you could be looking at about let's call it about 6,000 for the surgery. Plus there was the initial vet visit when we went. So we're looking at $6,500 total. You might need another $300-400 worth of like supplies, a harness and this and that to do the physiotherapy. And then if you're going to physiotherapy, you're looking at another, let's just say $1,000 on the moderate side, right? So this is around a $7,500 issue if this happens to your dog. As I said in the video earlier, protect your investment. Very, very important. The vet is very happy with how things are coming along, and that's because Chickpea has not been off leash for 1 second. Nothing, everything. Going to eat, I walk her over there on a leash just across the room because my fear is she leaps off this bed, runs over there, and something happens. So this is, I'm not kidding when I tell you guys, she has not been moving off a leash for 4 months. 4 months. Every movement this dog has done has been on a leash. That's how serious I took all of this, and that's why Chickpea is doing so well right now. Right, P? Having a little nap? All right. I may do one more video in a month once we're totally past the post-op period and I can show the Chickpea can run around off leash again. So we'll give you that video so you can taste a little bit of Chickpea's success. But for now, the next 4 weeks, continuing to increase and build that muscle up, but still making sure that I'm in good control of her movements and that she doesn't get to do something that would jeopardize the final stages of the healing. All right, but that's it for this video, and I will probably post one up in another month so we can see where Chickpea's at after everything is finished. Hopefully this has been helpful to you if your dog has just sustained this injury or you're about to go through the surgery. Hopefully this has helped you sort of understand what to expect and exactly what you're going to have to do to take care of your dog. And let's say it one last time, protect your investment. All right, we'll see you in another video.